Endocrine disruptors, phthalates. Phthalates are one of the many endocrine disruptors found in everyday life that interfere with the normal functions of hormones within the human body. Phthalates are ubiquitous in the environment and are commonly used as plasticizers for polymers or soft plastics. They can be found in soft plastic toys, such as baby toys, squeeze toys, inflatable toys, shower curtains, binders, backpacks, in cosmetics like shampoos, deodorants, lotions, and even medical equipment such as rubber gloves, catheters, fluid bags, tubing, enteral feeding, dialysis equipment, and much more. Phthalates make plastics soft and flexible and are very effective in the production of baby toys and medical supplies. The general structure of a phthalate is a benzene structure with two adjacent side chains, making it an orthophthalate, and is connected to two ester linkages. The most common phthalate used in everyday products like polyvinyl chloride plastics or PVC plastics is called di-2-ethylhexyl phthalate, or DEHP for short. Benzene is a nonpolar compound which makes phthalates lipophilic substances with low solubility in water. Phthalates are fluid in wide temperature ranges. For example, DEHP is fluid from -50 to 350 degrees Celsius. The level of toxicity, chemical and physical properties of phthalates depend on the length of the side chains. Due to its low water solubility, phthalates hydrolyze relatively slowly and have low volatility. Phthalates are not chemically bound to its products, which makes it very easy for the phthalates to leach out into the environment and migrate into the body, especially through prolonged mouthing action. This particular concern is common among infants when it comes to phthalate ingestion due to their tendency towards biting, chewing, and sucking on phthalate-containing toys, which then enters their body through the saliva. Also, pregnant mothers subjected to high levels of phthalates are at a greater risk of having children with deformed sex organs. Phthalates disrupt the endocrine system by blocking the effect of androgens in reproductive tissues, making it a large threat to the male reproductive system. The phthalates work by blocking androgen receptors through competitive binding or by inhibiting the production of androgens. This results in the malformation of reproductive organs and can cause conditions such as cryptorchidism, where there is an undescended testes, and hypospadias, in which the urethral opening does not develop at the tip of the penis. The inhibition of androgens results in lower sperm counts and lower testosterone levels in males, which affects spermatogenesis, a process that produces and develops sperm cells in the testes from spermatogoneous cells. The concentrations of the male reproductive hormones are affected, which disrupts the negative feedback system normally used by the body to regulate these hormones. Because phthalates are binding to androgen receptors instead of the androgens themselves, there's an overabundance of testosterone which sends a message to the hypothalamus to reduce the secretion of menstrual regulatory hormones from the anterior pituitary, such as gonadotropin-releasing hormone, or GnRH, and luteinizing hormone, LH. This causes Sertoli cells to secrete inhibin, whose function is to reduce the secretion of follicle-stimulating hormones, FSH. With the androgen receptors blocked, major sex hormones such as testosterone are inhibited, and sexual development is inhibited, resulting in the malformation of reproductive organs. Phthalates may also be responsible for the early onset of puberty among females as young as the age of 8. Canadian guidelines suggest that phthalates such as DEHP should not be used in items that are likely to go in children's mouths, cosmetics, or commonly used plastics. However, manufacturers are not legally bound by these guidelines. There are restrictions on the amount of phthalates that can be contained in childcare products, but there are no restrictions on use in cosmetics. Plastics with recycling code 3 should be avoided as they contain phthalates. It is recommended that plastics with recycling codes number 2, 4, 5, and 7 should be used, which indicates that the plastic is not made of phthalates. Calling manufacturers to see if phthalates are used in the production of their products is also recommended to remain updated on information regarding plastic production. Instead of using plastic Tupperware containers, try switching to glass containers and using plastic wrap made from low-density polyethylene. In terms of daily use, it should be kept in mind not all manufacturers will list the ingredients found in scented products for competitive purposes among companies, so limit the use of scented cosmetics. By doing so, you will be keeping you and your family safe from the dangers of the endocrine disrupting chemical phthalate.